welcome you formally to Personal Care Physicians.
Thank you so much. I'm so excited to get started. I think it's going to be a great partnership.
My first question is, what, in your words, is the biggest problem with the healthcare situation as it is in our country right now?
One of the biggest problems is going to be supply and demand. I think that having the number of providers to provide quality care to the number of patients that are going to deserve and need that care is going to be a long-standing challenge. And I think that's not sustainable, at least to do the kind of care that I think patients deserve, which is basically that personal touch.
Dr. Tuominen, can you give me an example of a time when the current healthcare model has let you down or let one of your patients down?
When a lab result comes in late on a Friday that may not be dealt with till Monday, that could potentially cause significant health damage to that patient over the weekend by not having that result. And just because there's lack of time. There's just not enough time to cover all of the patients and all of their needs given the current system.
So tell us about why you chose to join Personal Care Physicians.
In seeing the type of practice that Personal Care Physicians has put together, I really found that it was exactly what I wanted to do. The ideal combination is to have enough time to spend with each patient, but also to get to know them as a person. And to do that in the current system just is not sustainable. And so Personal Care Physicians has put together a great model. Combines all of the things I talked to almost all my patients about: diet, exercise, stress relief, sleep, but it allows me, or will allow me, to have the time to spend and actually follow through on each of those for those patients to maximize their health.
What do you think is one of the key differentiators between personal care physicians and other concierge practices?
And looking at different practices, basically trying to figure out how I can provide the best possible care. If we're looking at ideal care, how could I provide the best care to each of my patients? If I give the prescription for diet or exercise, when they leave my office, they have to come up with the tools. I can provide a few examples, but they have to really overcome some major barriers, and to do that, and that's oftentimes is what hinders them from good health. Well, with Personal Care Physicians, what they've done is they've really raised the bar, and they've said, you know what, we're going to take down those barriers. So they've incorporated a health fit studio within the practice. So there's basically no excuse for patients to reach that level of health that each of us can reach, to reach their potential of good health. We'll have an aesthetic center within the practice. So the trust is already there with the providers, and they'll be able to look as good and feel as good on the outside as they do on the inside.
Thanks for spending time with us today, Dr. Tuominen. It's really good to get to know you better, and we're looking forward to having you.
Thank you. I'm so looking forward to this partnership, and invite any of my current patients or future patients to take a look at Personal Care Physicians.